Hi, today I'm here with Dr. Michael Rapoff, Professor of Pediatrics at the University of Kansas Medical Center. And today we're going to be talking about adherence to pediatric medical regimens. So thank you very much for being here today.
You're welcome.
So my first question is, what is adherence?
Well, it's a bit of a technical term, but I try to explain to parents that adherence simply means, in their case, trying to help their children be consistent as they can be in following medical treatments that have been recommended by their doctor.
Okay, so then what would qualify as, being non-adherent to doctor's orders?
Can vary depending on the regimen, the disease in the regimen. For example, children who have hypertension, for example, if they took 80% or more of their medications over time, they probably would do fine. Their blood pressure would be under good control. However, for children with HIV or AIDS, for example, they have medications they have to take, a complicated regimen, that they probably need to take at least 95% or more of their meds to really get a good outcome. So it varies depending on the disease and the regimen.
So why is adherence important for parents to keep track of?
Well, it directly influences how effective the treatment is. The doctor can prescribe effective treatments, but if you don't follow it consistently, then you won't get the full benefits. In some cases, you can create more side effects. It also is a money issue because people are spending money on medications they're not giving. So it can cost both families and actually insurance companies and society as a whole. Mm-hmm. So it's a big economic problem as well as health problem.
Mm-hmm. And in your experience, what are some of the consequences that families have faced due to non-adherence?
Well, for example, children with asthma, we know that if they have fairly severe asthma, moderate to severe asthma, and they're not following their treatment program, they are more likely to end up in the hospital. They're more likely to miss school, and that affects their academic performance and their social life. They also are more likely to die from asthma. It's a rare occurrence, but that's one of the risk factors, is if they're not following their treatment consistently.
So I can imagine that it's pretty difficult for children to keep track of doctor's orders, medical routines by themselves. What can parents do to keep track of their children, make sure that their children are following these orders?
Yeah, the parent's role is very important in terms of monitoring what the kids are doing. Parents have responsibility, obviously, for very young children. They have the primary responsibility for making sure they give their children their medications when they're supposed to. We have some families that keep track of that on a calendar that they might put on their refrigerator, or they might set their watch alarm on times when they have to give their children medicines. And then as the children get older, they can assume more responsibility for taking their medicine, but parents still need to monitor and supervise what the kids are doing, like you would with any other thing, like schoolwork and their chores that they have to do at home. So it's just one other sets of things sometimes that chronically ill kids have to do that other kids don't have to do.
Mm-hmm. Do you have any favorite strategies that you would recommend for parents that are having difficulty getting their child to take their medication?
Well, I'd say the first thing is to make sure that they understand what their child's illness is, why they're being prescribed whatever it is they're being prescribed, most often the medication. What's the purpose? What's it supposed to be doing for the child? So they understand that elements of it. And then consistently monitoring their children's adherence and rewarding them. Sometimes just praise is enough. I mean, children very much want their parents' acceptance and encouragement. So just saying, oh, you did a great job taking your pills. Sometimes we set up reward programs for kids where they earn points, or we use little poker chips sometimes they earn for taking their medicines, and they trade them in for special kind of privileges and things like that. We even sometimes have to teach parents how to discipline children, because it's really hard when your child has a chronic illness to discipline them, to add more negatives to their lives, and have quite a lot of negatives. So for younger children, for example, we often have to teach parents how to do time out. So if their child refuses to take their medicine, they have to sit in time out, and like they would for anything they refuse to do. And then when they're done with their time out, they come back and parents say, now are you ready to take your medicine? And for the most part, kids then will do that. They'll take their medicine without any further problems.
So I can imagine that some parents might say, well, my child is 10 years old now, or my child's 13 years old now. Shouldn't they just be doing this on their own? What would your response be to that?
If they are, that's great. Then you don't need to worry too much about it. And there are some children that, as young as 10, show that level of maturity and self-control and management of their own disease and do it fine on their own with some help from their parents. There are other kids that developmentally or cognitively are not there yet, and they're not able to take on responsibility. So it has to be individualized. Some kids are ready earlier than others. Parents have to make sure they don't withdraw their support and their monitoring too quickly as the children transition from childhood to adolescence, and then from adolescence to young adulthood, that they make sure that the kids have the skills and the motivation to carry on the regimen on their own.
Mm-hmm. So I can imagine also that it might be tough for some parents to actually implement some of the behavioral strategies that you were mentioning. What kinds of professionals are out there in the community that parents can seek help from?
Well, pediatric psychologists are specifically trained to deal with children and teenagers who have chronic health problems and to deal with adherence issues. The problem is there are not as many of us as we like around the country. Most of them were connected to academic medical centers. But one of the things they can do is call their local mental health center if they don't have a pediatric psychologist that's affiliated with maybe an academic medical center in their community. But the first place I usually like parents to start is with their own child's pediatrician. Say, who can I go to? Who do you know that could help me with this problem? And often the pediatricians have a really good handle on what resources there are in the community and what people are there. I practice, for example, 1 day a week in a pediatrician's offices, so it's a readily available referral source. They just refer to me there, and I see the patients in their own clinic. But that's not always possible. But pediatricians usually are the first ones to go to, who would have some knowledge of what resources are available in the community.
Are there any other bits of advice that you have for parents?
Well, that they, like I said before, that they really have a very good understanding of what their child's condition is, what diagnosis they've been given, what's the prognosis, what's the treatment, what are some strategies they use to motivate their children to follow their treatment, to treat their child like a child, to remember that they are a child first. They have a chronic illness, but like other children, they need guidance and clear expectations and discipline, and probably need it more than kids who don't have a chronic illness, because they have to deal with the usual kind of demands on children, plus the demands that are inherent with having a chronic illness. And then also making sure that they themselves get good support from maybe their spouse, significant other, family members who support them in helping to raise their child. And also having contact with other parents. There are really good parent groups that they can join, that they can meet with other parents whose children have a particular chronic illness like their child, and learn some really good strategies. And if anything, get a lot of empathy and support from groups like that.
Great. Well, thank you very much for all that information.
You're welcome.